Okay.
So kita start topik hari ni respiratory system. Kita start from organ yang ada dalam respiratory system. Organ dia divided into two parts, upper and lower. Upper ada nose and pharynx.
I can hear a little bit lah. It just a bit louder lah.
Okay, okay,
Um,
okay. So kita start from organ yang ada dalam respiratory system. Dengar? Dengar tak? Jelas tak? Okay. Organ dia divided into two parts, upper dengan lower. Upper ada nose and pharynx, lower ada trachea, larynx, bronchi, bronchioles, and lungs. Phonetic zone consists of air, all airways that carry air to lungs, include nose, pharynx, trachea, larynx, bronchi, bronchioles, and terminal bronchioles. Respiratory pula ada include respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. Parts-parts yang involved dalam gas exchange ni ada respiratory bronchioles, alveolar ducts, and alveolar sacs. Okay. And slide ini labeling organs. And slide ini labeling organs dia. So let's pergi ke nose. Dalam lubang hidung tu kan dia ada cilia dan cilia ni functions untuk filter out dust and large foreign particles from external nose pergi ke nasal cavity and ke internal notch. Nasal cavity tu dia lies over the mouth, lepas tu ada palate yang spread dia from mouth. Lepas tu kat hidung ada bone and cartilage yang divide nose jadi dua sides. Yang ni dia kita panggil septum. Lepas tu ada 3 bone yang kita panggil concave. Yang ni dia discovered by mucous membrane dan dia create narrow passages so that most air can contact dengan mucous membrane. Apabila air pass through, dia akan pick up moisture and heat from mucosa. So nose ni dia akan warm, humidify, filter dust and microbes kat upper part nasal cavity. Ada olfactory nerve. They are responsible for the sense of smell. So now kita move on ke pharynx. Dia boleh dibahagikan kepada 3 parts. Yang paling atas tu nasopharynx. Yang paling atas tu nasopharynx dia extend from posterior nose to the soft plate dan dia contain opening for right and left auditorial tubes and equalize pressure in ear and outside the body. Dan bahagian kedua adalah oropharynx. Ini dia space between soft palate and the base of the tongue as well as the lingual tonsils found at the base of the tongue. And tonsil consonant can contain high concentration of red cell to fight infection. Lepas tu, part yang ketiga ialah laryngopharynx. Dia passes closer to larynx and connects to the esophagus. Only air yang boleh pass through nasopharynx, both food and air boleh pass through oropharynx and laryngopharynx. Pharyngeal tonsil ni dia implicated in snoring and sleep apnea. Sebab dia swollen and inflamed, dia akan jadi besar and block airflow through the nose. So now kita move on ke larynx, iaitu voice box kita. Main function dia dapat prevent food and liquid from entering the trachea. Act as an air passageway between the pharynx and trachea, and dia juga akan produce sound. Larynx ni ada 9 cartilage, dia keep it from collapsing. Lepas tu ada epiglottis. Epiglottis made up of elastic cartilage and dia akan cover larynx. When swallowing to prevent choking, part of the mucous membrane of the larynx form a part of fold through vocal cord in dia vibrate with expelled air. Ability untuk vocal cord to vibrate allow to speak. Cartilage yang terbesar tu thyroid cartilage. Voice production. Mucous membrane of larynx forms two parts of folds, upper dengan lower. Contains elastic ligaments. When muscles pull elastic ligaments tight, vocal cords vibrate. Dan dia berlaku sounds in upper airways. Pitch adjusted by tensions or through vocal cords. Lower pitch of male voice. Vocal cords longer and thicker, vibrate more slower. Maybe yang ni susah nak faham, so I will share one video.
I hope you don't get queasy. I'm going to show you live video of a singer's vocal cords as she sings. You may want to sit down. Hi, I'm Chuck Gilmore with Power to Sing. Many students feel singing is a great mystery. They don't understand how their voice works, why it works the way it does, and what's involved with singing. It all begins with the vocal cords. Specialists look at your vocal cords with a flexible or a rigid scope. The flexible scope is a small cord with a camera at the end of it. It's inserted through the nose and extended down the throat to see the vocal cords. The rigid scope is like a large pen with a camera at the end. It's used looking into the mouth and throat. Both images look like this. This can be confusing because the vocal cords are horizontal in the throat, like this. They are not vertical like this. When the scope sees the chords and projects it on a monitor, they look like they're vertical or up and down. Vocal cords, sometimes called vocal folds, are located in the mid portion of your neck, about halfway down, between the top and the bottom of your neck. There are two vocal cords, and they're connected in the front of your neck and open and close in the back, or towards the back of your neck. They're located inside the voice box or larynx. The cords sit at the top of your windpipe or trachea. Men can feel the top of their voice box, often called the Adam's apple. Women have the same thing, but it's smaller and harder to feel with your finger. Your vocal cords are just behind the Adam's apple. Now, women can sometimes feel their Adam's apple by placing their finger here and gently pushing in on their neck. And about the first lump that you feel is the top of the larynx. About halfway down your neck, you can feel that small bump. That's your Adam's apple, ladies. And your vocal cords are just behind it. And I can feel a small V right in the center of the top of my Adam's apple. That's the cartilage. Now, at birth, our vocal cords are about the same length, approximately 2 millimeters. By age 20, women's cords are about 10 millimeters and men's 60 millimeters in length. The change for men is much greater, and this causes a deepening of the voice and can make singing during the vocal change much harder. Vocal cords are tissue and are three-dimensional. That means they have length, width, and depth. Just like other tissue in your body, there are different layers of tissue. Vocal cords have three primary layers: muscle, ligament, and mucosa. It's the slick outer layer of the vocal cord. The vocal cords open when we breathe and come together when we make noise with our voices, and are covered up when we swallow. A type of lid called the epiglottis closes over the vocal cords when we swallow. Sometimes fluid gets through and we cough to clear it out. When air passes through our vocal cords as we speak or sing, they create a series of sound waves, which we can hear. This series of sound waves we call vibration. The vocal cords create the initial vibrations, which is the initial tones we hear that begin the sound we make when speaking and singing. Now watch and listen as these vocal cords create the vibrations that become our voices. Do you know your vocal type? I'm not talking about whether you're
Now trachea. Trachea extends from the larynx to a cartilaginous ridge called carina. Trachea line with pseudostratified ciliated mucous membrane. Pseudostratified ciliated mucous membrane. C-shaped rings of cartilage support trachea and keep lumen open during exhalation. Okay. At the carina, the trachea branches into two primary bronchi and is supported by C-shaped rings of cartilage. The right bronchus is slightly wider and more vertical than the left. Any other left, right. After entering the lungs, the primary bronchi branch into secondary bronchi. The left lung consists of two lobes. It has two secondary bronchi, and the right lung has three lobes, so it has three bronchi. Secondary bronchi branch into smaller tertiary bronchi. The cartilaginous rings around the bronchi become irregular and disappear entirely in the smaller bronchioles. Tertiary bronchi continue to branch, resulting in very small airway called bronchioles. It has less cartilage, more smooth muscle. Bronchioles divides further to form thin walled passages. The right lung has three lobes: superior, middle, and inferior. The right lung contains two fissures: horizontal fissures and oblique fissures. For the left lung, it has only two lobes, superior and inferior. Lung surrounded by pleural membrane. Parietal pleura attached to the diaphragm and lining thoracic wall, white visceral pleura attached to lung. Over, overly, overline. Alveoli is a cup-shaped upstream of alveolar sacs. Alveoli composed of three types of cells. The first one is thin alveoli cells, which is simple squamous, and it is the site of gas exchange. The second one is scattered surfactant secreting cells. Surfactant is the fatty molecule made by cuboidal alveoli cells. Surfactant lowers the surface tension of the film of water lining each alveoli sac or so that alveoli do not collapse between each breath. Deoxygenated blood flows into alveoli through pulmonary arterioles, and oxygenated blood leaves alveoli via pulmonary venules. A mesh of pulmonary capillaries encases each alveolus. The extremely thin walls of the alveoli and the closeness of the capillaries allow for efficient gas exchange. Elastic fiber give alveoli the ability to expand during inhalation and spring back into shape during exhalation. During inspiration, air flows into the alveoli, inflating them like tiny balloons. Once filled, oxygen closes the respiratory membrane, which consists of the alveolar epithelium, the capillary endothelium, and the joint basement membranes, as it moves out of the alveoli and into red blood cells in surrounding capillaries. As well as red blood cells take up oxygen, they release carbon dioxide, which then passes into the alveoli. Alveoli deflate during expiration, expelling the content of carbon dioxide, which travels back up the conducting airways to be expelled by the lungs. So, so, so part yang kedua, Sonia akan continue.
Okay. Can you guys hear me? Boleh tak? Okay. Okay, I present now. Sekejap ya. You guys can dengar, right? Can you guys hear? Boleh ah? Okay. So now kan we're gonna start with these three major steps. So I'm gonna go through all these steps kan. So the first step is the pulmonary ventilation, which is a process for moving air in and out of the lungs. So an example is inhalation and exhalation. Second is the internal respiration, which is the gas exchange between the alveoli and the blood. And then the third one is the internal respiration, which is the gas exchange between the blood and the cells. So first we're gonna go through the first step. Okay, so this is the first step. So in pulmonary ventilation, there's a gas law in the respiration. So the air flows from higher to a lower pressure. Okay, so due to that, pressure within the cavity is increased. So it increase, the cavity increase, the volume will be decreasing. Okay, so then the volume of a given amount of gas will increase within the increased temperature. Okay, so next I will explain about the inhalation. So if korang nampak kan, the diaphragm and the external intercostal is the muscle in the lungs, which is ini. This is the external intercostal, and then this is the diaphragm, which is like here. Okay. So if you see, during inhalation, the diaphragm will contract when you breathe in. Okay. And the external intercostal muscle will be within the ribs, with the ribs kan, ni, within the ribs, will contract also. Meaning that the ribs will go out and lift up, causing the chest cavity to expand. So it will expand lah, dia akan jadi besar lah. Okay. So and then, meaning by the diaphragm will contract kan, diaphragm is not going atas, it will come bawah, like go downwards. Okay. Okay, next is the cohesion between the pectoral and visceral pleura. So during this, the lung volume will be increased as the thorax volume will also increase. Okay, next is the exhalation. So exhalation is normally a passive process due to the muscle relaxation. So muscle relaxation meaning is like it's at rest, mostly at rest. Okay. So during exhalation, the diaphragm will relax and release and rises. Means yang diaphragm ni, the muscle is gonna go upwards now because it's exhalation. You're breathing out carbon dioxide. Okay. So then after that, the external intercostal also will relax, and this both muscles will decrease the lung volume. Okay. So if korang nampak the buku yang Amiro bagi, yang page 375, during forced exhalation, yang ni active exhalation lah. So means you're gonna breathe out air forcefully lah, exhale forcefully. So contohnya is you main seruling or semasa menjerit atau semasa menyanyi. Okay, during this forcefully exhalation, usually you will use additional muscle, which is the intercostal and the abdominal muscle. This is the internal intercostal, and then the abdominal is around here. Okay. So if you see here, the muscle of inhalation and their action is at the left side. So means it's going upwards. And the diaphragm will go downwards. Means your udara masuk dalam, okay? Then for the muscle, for exhalation, and their action is at the right side here, this one. So means everything will go downwards and the diaphragm will come upwards. It's terbalik lah. If you want, korang nak faham kan? So just remember that masa you inhale udara, you remember the diaphragm is akan go downwards. So then if it's going downwards, normally the external intercostal is going upwards. Then if for exhalation, you just remember that the diaphragm pergi atas, then the external will pergi bawah. Yang that's how I faham lah. Okay. Okay, next is the volume and the pressure changes in the lungs. So as you see, volume and pressure are inversely related, meaning that as the lung volume increases, the alveolar pressure will decreases. Then as the lung volume decreases, the alveolar pressure will increase. So you just whenever there's a question kan, so if they say the volume will increase, it's terbalikan lah, you just terbalikan. So if volume increase, alveolar pressure will decrease. Then if lung volume decreases, alveolar pressure will increase. Okay. So yang ni just now like tadi I explained kan, contraction of diaphragm. So means if the contraction of diaphragm means the diaphragm will pergi ke bawah. So if pergi ke bawah, the volume of the lung volume will increase. Therefore, you see it increase. If increase, the alveolar pressure will decreases. So meaning that if the alveolar pressure will decreases, it is less than the atmospheric pressure. Okay. So atmospheric pressure ni is kat luar, like luar at the outside of the lungs, like when you breathe in. Atmospheric pressure is kat luar, udara kat luar. So when the air, and then if air will enter inside the lungs, therefore this process is inhalation lah. Okay, then the relaxation of diaphragm. So if relaxation of diaphragm will pergi ke atas. So if pergi ke atas, the lung volume will decreases, and then if it decreases, the alveolar pressure will increase. So if it increase, if the alveolar pressure increases, it is greater than the atmospheric pressure outside the lungs. So means the lungs outside, the air outside is greater than the lungs, the volume inside of the lungs. So therefore, the air will leave the lungs. So this is then after that, then this is called the pressure of exhalation lah. Okay. So next is this is like how the volume, pressure, and changes in the lungs lah. If you see this, first is at rest kan. So the atmospheric, the alveolar pressure inside and outside is the same. Okay, at rest. So means the diaphragm is relaxed. Okay. So if you inhale air, udara masuk, so then the alveolar pressure will decrease, and it's lesser than the atmospheric pressure, but the lung volume increases. You see, it becomes bigger. Membesar lah, because you're inhaling air during inhalation. Then if it's during exhalation, the atmospheric pressure is greater than the alveolar pressure is greater than the atmospheric pressure lah. So means the diaphragm will relax, pergi atas, the air will go out during exhalation lah. So means it's called exhalation lah. Okay. Next is the airflow terms lah. Okay. So frequency is the frequency is the breadth per minute. Okay, this is like the volume lah, the value of frequency if you nak cari frequency lah. So normally is 12 lah. This is the normal value lah. Okay, tidal volume is the volume moved in one breath. Okay, in one breath. So normally is 500 ml. About 70% of the tidal volume reaches alveoli. So if it when it reaches the alveoli, it is 350 ml lah. Okay. Only this amount is involved in gas exchange. Okay, in gas exchange saja lah. So 30% in the airways are the atomic dead space. Okay, untuk fahamkan ni kan, later I will show the video lah. So I'll show video later. We need ventilation, which is the frequency times the tidal volume. So normally, if it's the frequency times the tidal volume is equals to 3000 milliliters per second, per minute. Sorry. Okay. Next is the lung volumes. Okay. Lung volumes normally is measured by the spirometer. So if spirometer, this is a spirometer. Wait, this is a spirometer. Normally, they use this to measure the lung volume. Kat hospital lah. Normally, like this. Okay, like this lah. This is a spirometer. Okay, so the external and the expiratory reserve volume, which is IRV, ni salah lah, IRV, is the volume of air that can be inhaled beyond the tidal volume, okay, TV. So the expiratory reserve volume, which is the ERV, is the volume of air that can be exhaled beyond the tidal volume. So if you guys remember kan, just now yang I explained, tidal volume ni is when you breathe in. So volume of one move in one breath means like you breathe in satu volume of air inside your lungs. Okay, so then the air remaining in the lungs after a maximum expiration is called the residual volume lah. Okay, so if you guys want to know more about the spirometer kan, you just watch this video dalam slide lah. Okay, untuk lebih faham lah. So now I want to explain more on the lung volume, right, by showing you guys yang ni, this graph. So I'm going to explain this graph to you guys lah, so that you guys lebih faham lah. Okay, so if you see this one at the y-axis kan, this is the lung volume. Okay, this is all here is the lung volume. So if the this is the lung volume at the y-axis. If you pergi ke atas, this process is inhalation, okay, or aspiration. If pergi ke bawah is exhalation or expiration. Okay, so normally this one 6,000 ml normally is a total lung volume for a adult male. But for female, it's around here 4,500 ml for female adults. So here, okay, that's that. Then for the x-axis, this is the time. But normally we won't see this lah. So we mostly will see this one, ni y-axis lah. We gonna see this y-axis lah. This x-axis normally there's nothing. But untuk korang lebih faham, ni masa lah. Y-axis, x-axis is the time. So if you see, for the lung volume, right, we see is this one. The tidal volume is this one, the first one. So the amount of air that moves in the lungs with the each expiration means inhalation lah, udara masuk dalam. During a quiet breathing is the tidal volume for 500 ml ni. So if it's 500 ml, if it's liter, it's 5 liters lah. So it's like this. You go like this. Slow. Like short, it's a short breath lah, quiet one. This one. So then second one, let's say lah, if you're breathing normally lah, and then suddenly you take a big breath like this. So if you're taking a big breath in this is called the inspiratory reserve volume. This one. If you inhale banyak, like if you inhale banyak lah udara forcefully lah, is become like this, okay? Then the third one, if we breathe normally, so normal that the tidal volume, then we'll have maximal expiratory. Where is sini, here, okay? This will have the maximal expiratory phase in the expiratory reserve volume. So if it's like this, from here, from inhale, so big, then you exhale, udara keluar, then you become like this. You go downwards. So here is this will be around 1.5 liters lah. So if 1.5 means 1,500 milliliters. Okay. So the last one, the fourth one, is if the air is left, like how I said this one, if the remaining air, udara yang terbaki kan, is here, when the air is left in the lungs after a maximal expiratory reserve volume or effort, it is called the residual volume lah. So this, if the remaining usually is around 1,000 milliliters lah. This is the residual volume. Okay, next I'll explain the lung capacity, CT. So if the inspiratory capacity is normally is the tidal volume plus with the inspiratory reserve volume, which is this tidal volume tambah ini, then if these two combined together is called the inspiratory capacity, tidal volume and the IRV. Okay. Okay. So then the functional residual capacity, which is FRC, it is the residual volume tambah dengan the expiratory reserve volume. This one. Sini. The functional residual capacity. So the I is called, so this one untuk cari ini is you have to do is RV tambah dengan ERV untuk cari functional residual capacity. So vital capacity, we see it is equal to IRV tambah dengan TV dengan RVT. If you see, ni. IRV tambah dengan VTV dengan ERV is to find the vital capacity. Okay. Then the total lung capacity is ni. Total lung capacity is you just kena tambah semua ni. this is the total lung capacity. You tambah semua of all the lung volume ni semua to get untuk cari total lung capacity lah. So yang this is how I fahamkan this graph lah. So I hope korang faham lah. If tak faham, you just I can send the video so that you guys faham lah sikit. So now is the breathing pattern. So if korang nak lebih faham breathing pattern ni, if you guys tengok buku yang Amiro bagi, muka surat 381, that they gave a lot of the types of breathing patterns lah. So this the common one is apnea. So apnea ni is normal breathing, like how we all breathe lah, normally lah. Okay, it's highly a variable in pattern. Coastal breathing, shallow with ribs movement. Diaphragmatic breathing, which is deep breathing. Specific modification of speech and emotional responses, and also variation of coughing and sneezing to clear air with. So I akan tunjuk korang a video lah, okay?
You will hear the different breathing patterns that you'll see in the study for your Step 1 exam. This includes Shane-Stokes breathing pattern, Cosmos, and Biot's breathing patterns. First, we'll have to be familiar with the normal breathing pattern, eupnea, and this will be our baseline. And it goes something like this. Next, we have tachypnea, which is the rapid breathing, and we see this in many disorders such as pulmonary embolisms, MIs, panic disorders, and many others. And here's how it sounds like. Next, we have bradypnea, which is the low-frequency breathing pattern that we see in obesity and alcoholism. Next, we have Biot's breathing pattern, which is the result of brain insult. Think of strokes, encephalitis, or many others. It's described as a period of apnea, followed by rapid breathing, and followed by another period of apnea. And here's the pathophysiology behind it. We know that the brain normally controls the normal breathing pattern, but in case of brain injury, the breathing center will be inhibited and will only start functioning again in case of strong stimulus. In this case, the strong stimulus is increasing levels of carbon dioxide in the blood. And here is how it sounds like. Next, we have Shane-Stokes pattern, which is the result of cardiac damage. It's similar to Biot's breathing pattern because they're both preceded and followed by a period of apnea. However, Shane-Stokes pattern is gradual increase followed by gradual decrease. And here's how it sounds like. And finally, we have Cosmol's breathing pattern, and we see it in acidotic states. It's similar to tachypnea, but it differs because it has long tidal waves. So it's maximum inhalation followed by maximum exhalation, but in very rapid rate. It makes sense because in acidotic states we can decrease the acidity by decreasing carbon dioxide concentration. And here's how it sounds like. Alright guys, that's all I have. Hopefully this helps, and I'll see you guys later.
Okay, yang tu they just gave a lot more terms lah, but yang common one is this one apnea dengan hyperventilation dan hypoventilation lah. So korang take note lah, yang tiga tu yang important lah if come out dalam test lah nanti. Okay, so next ialah the nature of air. So the mixture of air normally is the nitrogen, oxygen, carbon dioxide dan water and others lah. Okay. Each gas has own partial pressure, such as the pressure of oxygen or the pressure of nitrogen lah. Okay. The sum of all particle pressures is also the same as the atmospheric pressure lah kat luar, the low air outside. Okay. So if each gas diffuses down its partial pressure gradient lah. So each of these gases all these gases would diffuse down towards the partial to the partial pressure gradient. Okay, now we go into the second step yang tadi I explained. So the second step is the pulmonary gas exchange. So we're gonna learn these two types of gas exchange, which is the external respiration and the internal respiration, which is the systematic gas exchange and the pulmonary gas exchange lah. So the pulmonary gas exchange, it diffuses across the alveolar or the capillary membrane lah. Okay, so oxygen diffuses from air. The pressure of the oxygen is this. Okay, this is the pressure of the oxygen. To the pulmonary artery means when the oxygen diffuses to the pulmonary artery is the blue color blood. Okay, so this blue color blood, so that is called the blue color blood lah. If you guys tengok, that's blue color lah. It looks like blue color lah. Means it's oxygenated blood lah, this one. This process, the oxygenated blood. Okay, so it continues until the equilibrium. Meanwhile, the blue blood diffuses to the alveolar air, which is the pressure of the carbon dioxide diffuses to the alveolar air. Okay. So then the systematic gas exchange, which is the internal respiratory, it occurs throughout body. Oxygen diffuses from blood to cell down partial pressure gradient. The pressure of oxygen lowers in the cell than in the blood because oxygen is used in the cellular metabolism. Meanwhile, the carbon dioxide diffuses in the opposite direction, which is this from the cell towards the blood. Okay, so this is the internal and the external respiration lah. So you see so oxygen will come in, means you inhaling the oxygen. Okay, you inhalekan the oxygen, udara masuk. When the udara masuk, you pergi ke the left atrium at the heart. So oxygenated blood lah. Okay, oxygenated blood. So when it comes to the left atrium, kat sini, the left atrium, you pump and go out towards the tissue cells. From the tissue cells, you go here. So means here is the pulmonary gas exchange kan. So pulmonary gas exchange is usually the oxygen yang masuk dalam your jantung lah, dalam jantung. Then after that, the systematic is when the oxygen masuk ke dalam cell lah. So this is the systematic gas exchange, which is also called the internal respiration lah. So udara will go into the cells lah. So then after the udara masuk, the oxygen masuk, carbon dioxide will keluar. So when it keluar, it pergi ke right atrium. So after pergi ke right atrium, so now this one, semua ni is deoxygenated blood tau. So means tak ada udara, tak ada oxygen, is already carbon dioxide. So when it goes to the right atrium, it goes to the lungs. Then through the lungs, back, go out. Then the carbon dioxide will go out and you breathe out the carbon dioxide lah. So then the process will repeat lah itself. So then when you inhale again, oxygen will come in, go to the heart, go to the cells. Then carbon dioxide come out, go to the heart, pergi jantung, keluar the paru-paru. Okay. So next is the transport of oxygen within the blood. So 98.5% of the oxygen is bound to the hemoglobin in the red blood cell, binding depending on the pressure of oxygen. So higher oxygen in the lungs, it is lower in the tissues. So then when oxygen dissolves poorly in the plasma, so it's only 1.5% is transported in the plasma. Okay, tissue release of oxygen to the cell is increased by the factor present during exercise. So masa kita exercise lah. Okay, so when you exercise kan, normally you have high carbon dioxide. Carbon dioxide from the active muscles. Okay, the more carbon dioxide will produce. Acidity means the lactic acid from the active muscle will come. It will become more acid. Then higher pressure during exercise. So if korang nampak kan, masa kita bersenam, normally our temperature will increase kan. So meaning that if your temperature will increase, more carbon dioxide is coming out from your body and you're trying to inhale more oxygen because you are trying to breathe more oxygen and release more carbon dioxide lah. Okay. So next is the transport of carbon dioxide. So if carbon dioxide diffuses from the cells into the blood, like just now I show you guys, the carbon dioxide carries in the blood, some dissolve in the plasma. Okay. So when it dissolves in the plasma, it's bound to proteins, including the hemoglobin. Okay. Mostly as a part of the bicarbonate ions. Okay. This is the chemical equation lah. So I tak sure if we kena hafal chemical equation, but just in case lah, nak tiba-tiba kan dalam exam nanti test nanti dia keluar, so just korang just hafal ni lah. Okay, hafal ni untuk lebih faham what the question nak bagi lah, if they say if a part of the bicarbonate ion. Okay, so the process reverses in the lungs as the carbon dioxide diffuses from the blood into the alveolar air, and then you exhale lah. So udara akan keluar dari paru-paru. Okay, so this is the transport of carbon dioxide and the oxygen. So normally when oxygen masuk, you go mostly ke red blood cell, then in the plasma. Ni is the plasma lah, and this is the red blood cell. So all the oxygen akan berkumpul dalam red blood cell. So after dia berkumpul dalam red blood cell, it go through the heart, so it go through the left atrium. After the left atrium, dia akan pergi ke tissue cells. So after the tissue cells kat sini, some of it dia pergi ke dalam the tissues, semua tissue ni. Then the red blood cell will also release oxygen kat sini, so that will go into the tissue. Then after that, carbon dioxide akan keluar. After carbon dioxide keluar, you pergi ke dalam your blood. So then your blood now will have only of carbon dioxide. So when the carbon dioxide goes to the heart, then pergi ke lungs. The process yang tadi I explain. You go back out, you go back to the alveoli, and then after that, dia akan keluar badan. So same process lah. Okay, okay. So now I'll pass it back to Li Ying to explain about the control of respiration, okay? Okay.
For this part, I'll discuss about the control of respiration. Apa itu respiration? Respiration is controlled by respiratory centers of the brain that stimulate the contraction of the diaphragm and the intercostal muscles. Medullary rhythmicity area kat medulla oblongata. Area ni dia made up of two collection of neurons, the dorsal and ventral respiratory groups. Dorsal untuk inspiratory area and ventral untuk expiratory area. Yang ini ringkasan this part sahaja, so let's move to this slide. During normal quiet breathing, neurons of the dorsal respiratory group generate impulses to the diaphragm via phrenic nerves and the external intercostal muscle via the intercostal nerves. Apabila impulses ni aktif, dia akan increase in strength for about 2 seconds. So diaphragm and external intercostal contract. So diaphragm dan ini akan berlaku inhalation, normal quiet inhalation. Lepas tu apabila inspiratory area becomes inactive after 2 seconds, pada saat yang ketiga, ni akan berlaku diaphragm dan external intercostal relax, followed by elastic recoil of lungs. Dan akhirnya berlaku exhalation. These two inspiratory area and expiratory area impose a just length of inspiratory stimulation. Initial during forceful breathing. Forceful breathing ni boleh berlaku apabila kita sedang exercise atau at high altitudes. Okay, during forceful inhalation, nerve impulses from inspiratory area bukan sahaja stimulate the diaphragm and external intercostal muscle untuk contract. Mereka juga akan activate neurons of the expiratory area involved in forceful inhalation untuk hantar impulse ke diaphragm, sternocleidomastoid and scalene muscles contract. Contraction of these muscles result in forceful inhalation. During forceful exhalation, neurons of the expiratory area involved in forceful exhalation hantar nerve impulses to internal intercostal and abdominal muscles. Contraction of muscle-muscle ni juga result in forceful exhalation. Next is the regulation of respiratory center. Cortical input ni untuk voluntary adjustment of patterns. Control for talking or cessation of breathing while swimming. Cessation of breathing ni ialah pemberhentian pernafasan. Chemoreceptor input will override breath holding. Chemoreceptor input to the respiratory center untuk increase ventilation. Central receptors ni dia kat medulla oblongata, sensitive to hydrogen ion or pressure of carbon dioxide in CSF. CSF maksud cerebrospinal fluid. Peripheral receptors in arch of aorta and in carotids. Respond to decrease the pressure of oxygen as well as increase the hydrogen ion or pressure of carbon dioxide in blood. Blood and brain pH can be maintained by this negative feedback mechanism. This diagram shows the negative feedback control. First, some stimulus disrupt homeostasis by increasing arterial blood pressure of carbon dioxide or decreasing pH or pressure of oxygen. Then receptor, central chemoreceptor in medulla and peripheral chemoreceptor in aortic and carotid bodies. Then send nerve impulses to control center, which is inspiratory area in medulla oblongata. Then send nerve impulses to effectors. Muscles of inhalation and exhalation contract more forcefully and more frequently. This is also called hyperventilation. Then it will decrease in arterial blood pressure of carbon dioxide, increase in pH, and increase in pressure of oxygen. Then it will return to homeostasis when response brings arterial blood pressure of carbon dioxide, pH, and pressure of oxygen back to normal. Next, other regulatory factors of respiration. Respiration can be stimulated by limbic system. Anticipation of activities and emotion. Prior, proprioception as activity is started. Increase of of body temperature. Sudden pain can cause apnea. Apnea means stop breathing, but a prolonged pain, prolonged stomatic pain can increase breathing rate. Airway irritation can cause cough or sneeze. Inflation of inflation reflex. Bronchial wall strength receptor inhibit inspiration and prevents overinflation. The last one is aging and the respiratory system. Lung loss elasticity, lung loss elasticity or ability to recoil to become more rigid leads to decrease in vital capacity, decreased blood pressure of oxygen level, and decreased exercise capacity. Decreased macrophage activity and ciliary action led to increased susceptibility to pneumonia, bronchitis, and other disorders. This all from us. Thank you, guys.
I hope korang faham lah. If guys ada soalan, just bagi tahu anything. I can cuba faham kan? Faham. Thank you. Thank God. So, okay kan now? Ada soalan tak? Tanya je. Tak ada? Korang faham? For now, tak ada. Okay. Okay. So, if korang ada soalan, just tanya je lah dalam group. Atau PM lah saya. Just PM je. Okay. Thank you guys.
Thank you.
Thank you. Hope korang